Twisted Toenail 2. So today in my office, I see a patient that I hadn't seen in a year. It's been usually a time where I see them every 3 months to take care of their nail care, and she hadn't seen me really because of COVID. So it had been really since about January that we hadn't taken care of her toenails. So her toenails are really long, pretty thick. They're so long and that the shoes have kind of deformed those toenails to where they're actually growing sideways, upside down, this way, that way. And toenails can be influenced like that. So what we're doing is a medical debridement. And this is a lot different than a pedicure. I just want to emphasize that. I love my pedicurists. They do a great job. They make toenails beautiful that are normal toenails. Or even just mildly, incurvated. They can do wonders. What I'm doing here from a medical standpoint is that we have an 85-year-old woman who's got diabetes, poor circulation, and she's got super thick toenails that really it's too dangerous for her to try to cut these herself. Because if she ends up with a wound or some type of an infection, that could be disastrous. It could lead to amputation. It could lead to, really a loss of a toe, a foot, or even the lower leg. So we've got some toenails, and here I've got to be very careful because, she still has a little bit of pain if it's cut too aggressively. So I'm trying to gently just trim that off, and that came off without a problem. That second toe, if you can see, it's kind of pinched. So there's a bit of skin that's growing up in the middle of this toenail area, and that can be a source of, if you'll see later, sometimes a little bit of that skin can get trimmed and bleed a little bit. This great toenail is so thick that I had to take it off in pieces. It's literally growing sideways. It's thickened because of poor circulation, because of fungus, like in the toenail. This has been going on for years. She's had this type of toenails for 30 plus years. So we're not trying to treat it with fungal medications or oral antifungals. All we want to do is get it reduced. So after trimming them down, I'll use the rotary burr that will essentially just smooth off all the rough edges and try to bring the thickness down on these toenails. She needs to be able to wear her shoes. She needs to be able to not have discomfort from her toenails. And also, we don't want any further infection from a toenail that's growing into the skin or a toenail that's causing pressure to that area. You can see here we're burring that down, and there's a little piece there, and I'm going to make sure that we trim that off. And FYI, whenever we're burring these toenails, and this has been done for years, and this is the standard of practice, we're wearing a mask. Of course, in 2020 with COVID-19, everybody's wearing a mask now, so but we don't want any of that nail debris or dust to be inhaled. So this is a medical burr onto a device that almost looks like a Dremel. Dremel tools are great, and in the case of nail care, they come in very handy. You can see on that second toe, there's a little bit of that skin that's starting to come up. So the great toe, again, we just want to smooth it down as much as possible. And mind you, this is the first time I'm seeing her in a year. So my goal right now is just to get it maintained under control. When I see her next time in 3 months, we'll be able to really make sure that her toenails are a lot better maintained and comfortable. And it will allow her to wear shoes. That's the main goal. So just a little bleeder on that second toe. That's that nail bed tissue that's pinched up. and sometimes that little bit of that skin can be very fragile. Not a problem. I'd rather patients have a little bit of bleeding in the doctor's office so that we can make sure we control it and to make sure there's no infection. So as you can see, we're putting on a medication called Lumicaine, so that essentially will cauterize that nail, and it's almost like a tiny little blood vessel that comes up in the middle of the toenail from the nail bed. Making sure I'm trimming off any excess there, and we'll smooth it down even further. And afterwards, she was very happy, very thankful, very grateful that now she can wear her shoes and she can slowly get back to a normal schedule of her regular palliative nail care. And again, preventative foot care, this is what it's about. It's not about cosmetic results, but rather about functionality. We want it to look good, but she's not expecting it to be a pedicure, and she will be much happier when I see her back in 3 months. Take care. We'll see you next time.